Question 1. The nature of the stated hypothesis: women whose partners attended labor and delivery would need less pain relieving medication than women who were alone is. Options: A. Complex. B. Non-directional. C. Simple. D. Null. Right answer of this question is option C. Simple. Question 2. Barbequing, a cooking method, is a form of. Options: A. Roasting. B. Grilling. C. Sooting. D. Baking. Right answer of this question is option B. Grilling. Question 3. While evaluating the patient for complications of acute pancreatitis, the nurse should observe for. Options: A. Increased intracranial pressure. B. Hypertension. C. Bradycardia. D. Decreased urine output. Right answer of this question is option D. Decreased urine output. Question 4. All these are the rights of delegation except. Options: A. Right place. B. Right person. C. Right task. D. Right time. Right answer of this question is option A. Right place. Question 5. The immediate action to control severe bleeding is. Options: A. Apply direct pressure using hand or cloth. B. Apply dressing pad. C. Immobilize the injured part. D. Place the person in a suitable position. Right answer of this question is option A. Apply direct pressure using hand or cloth.
Question 7. Humoral immunity is mediated by. Options: A. Natural killer cells. B. T lymphocytes. C. B lymphocytes. D. Suppressor T cells. Answer of this question is option C. B lymphocytes. Question 8. The temporary hardness of water is due to presence of. Options of this question is A. Calcium chloride. B. Calcium bicarbonate. C. Magnesium sulfate. D. Calcium sulfate. Right answer of this question option B. Calcium bicarbonate. Question 9. A clinical sign that indicates the beginning of second stage of labor is. Options: A. Change in uterine shape. B. Bearing down reflex. C. Passage of mucus plug. D. Gush of dark blood. Right answer of this question option B. Bearing down reflex. Question 10. An example for superficial reflex. Options: A. Babinski reflex. B. Stretch reflex. C. Biceps jerk. D. Triceps jerk. Right answer of this question is option A. Babinski reflex. Question 11. Insulin 10U in 50 ml of 50% dextrose is prescribed for a patient with chronic renal failure to reverse. Options: A. Hyponatremia. B. Hyperglycemia. C. Hyperkalemia. D. Hyperkalemia. Right answer of this question is option D. Hyperkalemia. Question 12. A system of ventilation that blows fresh air into the room by centrifugal fans to create a positive pressure and displace the vitiated air is. Options: A. Exhaust ventilation. B. Balanced ventilation. C. Air conditioning ventilation. D. Plenum ventilation. Right answer of this question is option D. Plenum ventilation. Question 13. While preparing a pregnant woman for amniocentesis, the nurse should. Options: A. Prepare her for anesthesia. B. Instruct her to drink 1 L of water. C. Instruct her to void. D. Place her in left lateral position. Right answer of this question is option C. Instruct her to void. Question 14. The staple food of villages of 3000 population is maize. These villages are at risk for options A. Pellagra, B. Bitote spot, C. Scurvy, D. Beriberi. Right answer of this question is option A. Pellagra. Question 15. Which action confirms that the nurse is using Z technique to administer iron injection? Options A. Creates a Z-shaped grid on the abdomen and injects each dose daily. B. Uses the anterior lateral aspect of the thigh to inject. C. Pulls skin downward or laterally before inserting the needle. D. Uses special syringe to administer injection. Right answer of this question is option C. Pull skin downward or laterally before inserting the needle.
Question 16. Which of these is an independent nursing function? Options A. Assigning another nurse to administer medications. B. Limiting fluids when a patient has an intake order of 1 liter. C. Irrigating a patient's wound with normal saline. D. Applying a warm soak on an infiltrative site. Right answer of this question is option A. Assigning another nurse to administer medications. Question 17. The type of conflict a person experiences when he has two job options, one far away with good salary package and one near without scope for growth is options A. Approach. B. Double approach. C. Approach avoidance. D. Double approach avoidance. Right answer of this question is option D. Double approach avoidance. Question 18. An unresponsive child is lying on the floor. You shout for help. A check shows that the child is not breathing. The immediate action will be options A. Give external chest compressions. B. Give chest thrust and back blows. C. Look for external defibrillator. D. Start artificial respiration. Right answer of this question is option A. Give external chest compressions. Question 19. Which of these is an example for secondary reinforcer? Options A. Extra feed for the dog's jumping act. B. A chocolate to the child for finishing homework. C. A cup of water for the thirsty child. D. Praising the child on completing task. Right answer of this question is option D. Praising the child on completing task. Question 20. Arriving at a general conclusion based on specific observations is options A. Inductive reasoning. B. Deductive reasoning. C. Critical thinking. D. Convergent thinking. Right answer of this question is option A. Inductive reasoning. Question 21. The back pressure arm lift method of artificial respiration is known as options A. Schaefer-Nick method. B. Henry Heimlich method. C. Holger-Nielsen method. D. Roger-Buck method. Right answer of this question is option C. Holger-Nielsen method.